Good morning, Carls Andrews. I am Mihiraa. Let's start the warm-up sessions. What are the different roles of a nurse?
A nurse plays different roles in her profession. The primary role of a nurse is a caregiver. Apart from this role, she functions as a mediator, advocate, counselor, educator, and the like. A nurse plays a very crucial role in the healthcare system, connecting various departments in the industry for the welfare of patients.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are very essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I like to give to future nurses.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
Your preparation time is over. You can now start the role play.
Good morning, Mihiraa. How are you feeling today?
Good morning. I'm feeling a bit better, thank you. Still a bit anxious about going home, though.
I understand. It's completely normal to feel that way. I'm here to provide you with some important information about monitoring your blood pressure at home, which will help manage your condition and give you peace of mind. How does that sound?
That sounds helpful. I'm just worried about the fainting spells happening again.
I understand, Mihiraa. It's completely normal to feel worried about that. Rest assured, your discharge decision wasn't made lightly. It was a comprehensive decision by a multidisciplinary team of doctors, nurses, and specialists who have thoroughly assessed your condition. They've ruled out any serious cardiac issues and determined that the fainting spells were due to postural hypotension from stopping your blood pressure medication. We'll make sure you have all the information and support you need to manage this at home. Mihiraa, before we go any further, can you tell me if you've ever monitored your blood pressure at home before or if you're familiar with how to do it?
That's a relief to hear. But I'm not sure how to monitor my blood pressure correctly at home.
No problem at all. It's completely understandable to feel unsure, Mihiraa. Let's go through it together step by step. First, make sure you're in a comfortable seated position. Roll up your sleeve and rest your arm on a table with your palm facing up. Next, place the cuff around your upper arm, just above the elbow. It should be snug, but you should still be able to slide 2 fingers under it. Now, locate your pulse by feeling for it with your fingers. Once you've found it, turn on your blood pressure monitor and press the start button. The cuff will inflate and then slowly deflate. The monitor will display your blood pressure reading once it's done. Make sure to write down each reading. Mihiraa, the important thing is that you should take your blood pressure readings twice daily, once in the morning and once in the evening, at different times each day for 3 weeks. This will give us a good picture of how your blood pressure is doing over time. Does that make sense? Feel free to ask any questions if you're unsure about any part of the process.
Got it. And what should I do to avoid fainting?
That's a great question, Mihiraa. To help prevent fainting spells, there are a few important steps you can take. First, avoid getting up too quickly from a sitting or lying position. Take your time to move slowly and allow your body to adjust. It's also crucial to stay hydrated, so make sure you're drinking plenty of fluids throughout the day. If you start to feel dizzy, lie down immediately and elevate your legs. This helps increase blood flow to your brain and can prevent you from fainting. Do you have family or friends who can support you during this time? It's important to have someone around, especially in the first few days after you're discharged.
That's very helpful. I'll keep that in mind. Yes, my husband is at home, and my sister lives nearby.
Excellent. I'm glad to hear that, Mihiraa. Having a support network is crucial, and it's wonderful that you have your husband and sister close by. Their support will be very important as you recover. Physically, it's helpful to avoid prolonged standing and overexertion. Your family can assist with tasks that might require you to stand for long periods. Psychologically, having someone to talk to and share your worries or concerns with can make a big difference. Don't hesitate to lean on them for emotional support. Mihiraa, also, remember that we'll need to see you for a review appointment in 1 week. During that visit, we'll check your blood pressure, review your readings, and make any necessary adjustments to your care plan. If you have any questions or concerns before then, please don't hesitate to contact us. We're here to support you every step of the way.
Thank you. I feel much more confident now. Thank you, Nurse Andrews. I appreciate all your help.
You're welcome, Mihiraa. Take care and we'll see you next week.